In Sky Simplified Physical Exercises, one of the age-old branch is Magarasanam. And we were development-wise having an horizontal four-limbed state. And now we are assuming an erect posture, and this itself has changed the structure of the spine to a great extent. And now, with the development of the facilities, scientific developments, the extent to which we travel in all possible postures and the speed at which we travel beyond 100 kilometers per hour, and with the road conditions in all development, in all stages conditions, the strain on the spine is enormous. And we see the changes that take place in the spine is reflected on the functioning of the spine to a great extent. And I was just going through the spine vertebrae and their function and their condition subjected to the present day use of our spine. The travel in the four-wheelers and two-wheelers at unimaginable speed and jerks, acceleration and deceleration, and poor spine has to withstand the stress on it. And we have seen that orthopedics, the branch of medicine dealing with the bones and joints, is a very busy branch of medicine purely because of this spine facing the travel conditions. And in spite of all these misuse of the spine, our functional abilities are fairly maintained, and the Maharishi's Magarasana assumes more importance. And the nature of the spine with cervical, thoracic, lumbar, and sacral spines with the vertebral bodies. I was just asking Praveen to take a picture of the worst affected spine because our misuse. And it is a wonder that with all these conditions, we are able to get along still with the misused spine. And how Maharishi attends to these problems which are man-made. And the present day way we move about is very difficult to manage. And let us see what are all the problems faced by the spine and how Maharishi's single the Magarasana helps to manage these of use. See, it has the individual independently functioning vertebrae and the spinal cord has to pass through this spine and vertebral column, and the nerves, they have to come out of the spinal cord at the intercostal levels, at the vertebral levels, and the spinal nerves leaving the spinal column through the intervertebral foramina and the sinuous tract which is provided for the intercostal nerve to come out of the spinal canal. The track is tortuous, sinuous, bent, and all this thing. And this spinal canal is jam-packed with the nervous tissues and the vascular bundles. All have to come out of the spinal column, spinal canal to ramify the body. And we can see how the first the movements, the head is kept on the top of the spine and you have a 360-degree movements possible at the top of this thing, with the atlas and axis being the first and second vertebra. The movement is circumduction. You make a full circle with the neck moving, rotating on the axis, the second vertebra. And the Magarasana tries to give strength to the vertebral column, maintaining the activity of the spine to near normal. And the way Maharishi has designed this, the spinal column is almost fixed. It is very difficult to dismantle the vertebral bodies held together. And the inaccessibility, they are all, the vertebrae are locked one on the other and they have to move, facilitate the movement. At the same time, the structure within the spinal canal, the individual nerves have to come out and perform the function. So as I said, the track, the intervertebral phenomena is very tortuous in nature, and the canal is almost filled to the maximum capacity with the nerve and the artery vein and the spinal nerves, and all these almost fill the intervertebral canal, and any extra deviation from the normal path hurts the nerve root or the intercostal nerve as such. And you have so many structures to pass through and so many joints, movements, all make it complex. And our living conditions, the way we travel, has complicated it to the maximum. And Maharishi handles the problem in a masterly approach. The spine, we don't have liberty to move it the way we want. And the exercise Magarasanam deals with strengthening the spinal column and providing all possible movements. The head is moving in one direction, right or left, and the body below moves in the opposite direction. And you might have experienced washing the clothes and how we remove the water from the clothes. You twist the cloths and clockwise movements on the upper end, counterclockwise movements in the lower end, and these opposing forces meet at one point. And Maharishi, though he is not having any means to directly handle the spine, he is provided with the two hands and two legs. And these four limbs, he manipulates them in such a way to utilize these focal points on each vertebra individually and collectively. So these opposing movements is able to clear the accumulated strain at each vertebral body. And the individual vertebrae, they are designed in such a way to have a strong body and an arch to provide a spinal canal through which the spinal cord is housed and sends out its branches. And the amount of pain we have, radiculitis, the pain, shooting pain, right from the spine on either side, reaching the front of the body. And at times, when there is damage to the spinal processes, you have a girdle pain, a pain that is constricting from the spine. It comes round on the along the periphery of the body margin, and the pain is almost any prevents any movement of the spine. And in this difficult situation where you have to manage the movements of the spine as well as escape from the damage to the structures that pass through and that come out of the spinal canal to reach the entire body. And this movement of the spine, rotating movements on opposite directions, helps Magarasana to attend to the maximum problems which we come across in the spine. And Maharishi utilizes the supine position with the face up and face down either side, and manages to exercise the spine to give maximum benefit. And when we do this Magarasana in the face up position, the way the upper limbs and lower limbs are disposed in various forms uniquely satisfy and strengthen the vertebral problems. And next, the factors involved in Magarasana are the vertebrae and the articular surfaces, the superior surface and the inferior surface, and the intervertebral foramina through which the neurovascular bundle comes out. You have the intervertebral disc in between each this thing. They help to bend and move sidewards and all, and helps us with the maximum possible movements. Whereas the with each additional movement, it is the strain is more on the spinal column. The intervertebral discs, which provide mobility, prevents the shock of the individual vertebrae moving one above the other. And the spinal column is well padded up and strengthened by muscles, and the spinal muscles which cement moras, which gives stability to the vertebrae even though they are mobile. And the parts to be analyzed, to be focused on, are the surfaces the vertebra superior and inferior, and it will be well appreciated if we look into the shape and size of the vertebra. Each vertebra is a quadrangular, and the 3D picture of it, it has the body and the limbs, the transverse process, all unite to form the uh, spinal canal. And this spinal canal further has intervertebral joints, the facets, and the other things to provide maximum mobility. And the disc is designed in a perfect way that it is shock proof, has a jelly like material in the center of the disc with a tight, flexible outer layer of the disc. And this is responsible for removing the stress on the spine. Individual vertebrae moving in all possible directions and funny ways in with all velocities, speeds, exposes it to the maximum stress. The vertebrae are preserved and ably helped by the muscles, which give a tight, at the same time, a flexible, mobile joints. And the changes that take place in the bone, the muscles, and the way how we manage the problems that come to the spine is a very complicated process. And we have being from the branch of yoga, and that yoga helps in a big way to focus on individual areas and achieve the to meet the needs of the movement of the spine. What is unimaginable made it makes it made possible by the complicated process of yoga. The way the energy is directed up and down the spine by the mind, will of the individual, and the changes in the nervous tissue makes it possible to have all possible movements. And next, let us see how the intervertebral disc is designed and uh, saving the spine from the shocks. It has an elastic jelly-like material, viscous material in the center with the outer cover forming a bag with
Praveen, are
a
you sharing the screen? Or
Uh, yes, no. Is it not visible to everyone?
no.
One second.
Okay.
Is it visible, Vijayalakshmi?
Yeah, now we can able to see.
All right.
Thank
So
you.
the outer layer of the disc is thick and maintains its elasticity, preserving the jelly-like material, the pulp of the disc in the center. And the picture shows the adjacent vertebrae getting locked with the special arrangements. And you see the intervertebral foramina coming, accommodating the vein neurovascular bundle there. And the stress that is undergone by the spinal column is, if you look into the middle-aged or the senior person, individual, the body of the vertebra undergoes changes because of the strain. You can see the vertebra shown here with the articulating surfaces being bigger than the body of the vertebra. They give a concavity shape. This also helps in the locomotion. And the neurovascular bundle is well protected by the ribs, and on the inferior surface of the ribs you have a groove where this vascular bundle is safely travel around the body. And you can see the intervertebral foramina being occupied by the neurovascular bundle, and the color changes explain the strain on the uh, structures coming out of the spinal column through the intervertebral foramina. And next. So these pictures, set of pictures, shows how much of stress is there on the spinal column. The first picture shows the normal architecture, and the second and third progressively show the damage taking place and how it is tackled by remodeling the vertebral column. The intervertebral disc becomes thinned out, and it is the pressure exerted on this thing with various movements like jumping and compression from above on the sides all affect the vertebra very badly. Of the 5 columns shown here, the first one, red color, shows strain, and the second you see the intervertebral area becomes altered where the individual bones, vertebrae unite to form a bamboo-like structure, which is better shown in the third and fourth. And it is the body sacrifices the individual vertebrae to unite to form to give stability. And now in this picture, you can see the intercostal nerve with the ganglion there and the branches of the nerve, intercostal nerve, all wrapped up closely with the anatomy of with the structure of the vertebra. And next. The strain is so much. This picture shows the superior surface and the inferior surface of the adjacent vertebra become the one vertebra above and another below shows the smooth structure where the focus is shown there. The border of the vertebra becomes almost sawtoothed. That is, they become ups and downs like a structure of a saw, which we use to divide the single blocks of wood. Here it is probably exaggerated for you to appreciate well. And this narrowing of the disc compromises the size of the intervertebral foramina, and they are finding it difficult to get themselves accommodated. And the color shows the amount of stress there. Next. Here you see the disc is also trying to bulge out and apply pressure on the nerve roots. Next. So the changes in the vertebra and the intervertebral joints, they all affect the intervertebral foramina and its contents, namely the nerve and the blood vessels. And the clinical conditions, patients suffering from the deformities of the spinal column, they come out with all sorts of pains, shooting pain, the constant boring pain, and if it is intolerable by the nerve, the function is lost, where the initial increasing pain is replaced by dysfunction, absence of live nerve root, and the pain disappears and the sensitivity of the vertebral column disappears, which further damages the spine more easily. The lack of space complicates the surgery and demands high technical skill, in spite of which the surgery can produce damages and resulting in loss of function. The excellence can be appreciated by yoga practitioners who support and strengthen the structures, the surfaces, articulating surfaces, the foramina made up by the different projections in the spine, and the nature of abnormal movements. All these things are this thing. When there is a structural change and resulting injury to the nerve and neurovascular bundle is inevitable, the concentration of the individual, he is able to safeguard the area which is likely to damage the neurovascular bundle and the muscles with his concentration, focus, direction of the energy. And when the part is getting damaged, the yoga practitioner is able to focus on the damaged part, the focal part, and he is drawing the energy, the universal magnetism through the structures, nerves, and the tissues, muscles. He is able to draw the energy from the absolute space with the space crumbling to form energy particles, and they are packed with the uh, the basic divine dust particles, and these particles, subatomic particles, are capable of producing magnetism. Not only that, but they can combine in all possible ways to create the damaged part and normalize it. And the yoga practitioner is able to manage the pain that is produced because of the structural damage, and his concentration, the way he handles the energy particles and the magnetism there to reshape, accommodate the difficult areas of the spine to manage in a painless way. The newborn formation, restructuring the spinal column or helps to a great extent in this thing. The above factors resulting limitation creates a situation of unpredictability. A skilled master knows of this situation, can create miraculous cure by normalizing the degenerative anatomy abnormality to preserve normalcy. Next. Now from bone, let us move to the muscle. We have a variety of muscles, the striped muscles, the skeletal muscles, the smooth muscles, and the special muscles like cardiac muscles and this thing to perform difficult this thing. The muscle are formed by the muscle cells. The each individual cell can undergo a lot of changes. It can become thinned out or it can become stronger by hypertrophy. You can see the structure of a or normal individual and the bodybuilder, the one who manipulates each muscle and develops it to such a great extent that the successful people who specialize on the physical body to develop a body with various shapes, the biceps and the deltoids, the muscles of this thing, the pectorals, they are all well developed in a bodybuilder, weightlifter and all. And similarly, next. With all this, let us see how the Magarasanam works. And the spine படம் போட்டிருக்கீங்க. And the right or left arm. The structure of the spinal column has curvatures. The neck portion, you have the convexity to the front, concavity to the back, and in the thoracic region, it is a convexity with the prominence on with the concavity facing the front, convexity on the back. In the lumbar region, it is reversed and the line of weight transmission falls within the spinal column by these changes, and they preserve the movements, this thing. Next. You see the video here. The complicated function of contraction and relaxation is explained by the advances in the science with the intracellular and the chemical combinations, attachments and reattachments help this complicated process of contraction of the muscle and relaxation of the muscle, the locomotion and all the things are possible. And the skeletal muscles They give shape and structure, the contours, this thing, and the muscles, and they help in locomotion, and they give able support to the bones and preserve them from overusage and the dystrophy. So these muscles, they become stronger and they become harder with fibrosis, and the changes are numerous what they undergo. And next, the smooth muscle can, each fiber can become thick. This explains the unimaginable, the thickness, bulkiness of the muscles with specialized way of handling. And you have the special muscle, the cardiac muscle, where the cells are united. One fiber communicates with the other by the process of branching, and this helps the heart to function as a single unit. And the coordinated action is responsible for the superhuman performance of the circulatory system. While the muscles perform Herculean tasks, it also takes part in the finer, finer movements. The larger muscles gives strength to the movement, and the finer small muscles helps precision, and that makes the complicated movements possible. For example, the signature of an individual in the present day society is very vital for individualization, and the man is identified by his signature in vast number of places, and the uniqueness of the signature and the the difficulty to forge a signature is because of the articular way, the specialized way, the smaller muscles like lumbricals and the interspinal small muscles. The lumbricals are responsible for individualizing signatures, and the way the flow of the pen is facilitated by the finer movements of the lumbricals and this thing. Whereas the muscles are performing unimaginable tasks also. The way the iris functions, it is holding the capsule and lens in place and allows the focal length of the lens to be changed accordingly to help the vision to be handled in difficult terms. And now, next. The large muscles and the small muscles. The large muscles gives strength, while the small muscles helps precision and individuality. The goose flashes which you get on exclamation or due to the functioning of the uh, erector pylorem. Those muscles are responsible for the appearance of the goose flesh, and this action is taking part in where the emotional components is vital for its expression. And such small muscles, which are just filaments only, the muscle fibers only, they do wonders in adding value and the complexity of the emotional nature of the individuals. How the large and the small muscles coordinate to have a
Praveen,
normal range of
the
movement.
screen is not
Yes,
displaying. Yeah.
mm,
Are you
the
sharing?
picture.
It's gone again. Presentation.
Which one?
Presentation slides are not visible. Yeah. Yeah. Now.
Slides are not visible. They are visible now.
Yes. Yeah. We can able to see
Next.
now.
The muscle fibers, they alter to meet the demands of this thing. And what you see is not a grasshopper. It is a muscle called lumbricals. You can see the branching of the muscle and the attachment of the muscle to the tendon in a larger area, and they help to give way. They branch out and accommodate this thing. This structure of the lumbricals is responsible for the individuality and the identification of the individual by signature. And here the muscles present in the ear, middle ear, the ossicles where they articulate, responsible for the proper sound transmission. And this is the erector pylorem, the muscle which changes the angle at which the hair is present on the skin. Next. This muscle on the back of this thing is so big and is responsible for the way the Kalasis, people who work lifting loads of, they unload the transport vehicles, lorries, and it is such a wonder that that complicated job is done effortlessly by the muscles of this thing. And next, the structure of the muscle tendon in this thing explain the complicated nature of this thing. And the slender arrangement of the yogi and the muscular presentation of a bodybuilder. Next. The muscles are same, but the complicated structure function of the body is different, as shown in the behavior of the low back, knee, and the ankle performing different activities. The squatting kinetic chain is the most difficult to study, and Magarasanam picture it. Here, the legs, both the legs are straight and held close together, and this helps the body to rotate, and the head is moved to right side and the body is moved to the left side, and this opposing movements focuses at the upper cervical region, the upper half of the neck. When this focus has to come to the lower level of the spine, the neck itself is achieved by folding the legs, and as shown in the picture, and it is next. The next movement where the left leg is placed over the right and the twist is given to the body trunk, and this produces the change the dynamics in the spine, focusing on the upper thoracic region. And by changing the position of the legs, the right and left leg, by altering its position, the focus descends down to the thoracic, lower thoracic spine. Next. And by assuming this double decker position, where the heel is interposed between the first and second toes, this thing, it produces, it shifts the focus to the lumbar region, and upper lumbar and lower lumbar changes. In this way, you see the focus of the stress point moves from upper cervical to lower cervical, upper thoracic to lower thoracic, to the upper lumbar to the lower lumbar. And when you assume the uh, rotatory movements of both the legs, you get the sacroiliac joint into operation. So this is, yeah. So this shows that in the picture. And when the individual who lies down with the face up and changes to the lies on the face, on the belly, the movements of the points of concentration which I showed under the picture is reversed. Here in the position assumed by the individual focuses the lower lumbar region, and the change in the position with the bending of the legs, the upper lumbar region is activated, and in keeping one leg over the other, it is the lumbar region. And see how it moves from one focus to the other focus. Now in the cervical region, this thing. So this is responsible for the crocodile movement. Magaram, right. So you can see the movement upper cervical, and on part 2 it is the lower lumbar and lower cervical, and here the upper lumbar. Like that they move from one to the other. How coordinated movement takes place, and this is this thing. So the entire Magarasana covers a lot, and here the importance of the meditation and the contemplation in achieving structural correction by the dust particles received from the universal magnetism, helping the individual to design and produce necessary elements in this thing. Whereas by this way, he is able to correct the damages. The sports medicine and the accident orthopedics do wonders when the mind is exploited to erect the energy dynamic change and the correction of the subatomic orientation, damage to the atoms and their structures. They are all corrected by meditation. So this is an explanation of what Maharishi achieves with the understanding, scientific understanding, and the yogic expertise, and the final outcome is unimaginable, wonderful. It becomes a superhuman correction performance. Thank you. Vijay Lakshmi.
Yeah, வாழ்க வளமுடன் ஐயா. Thank you for
வாழ்க வளமுடன். Any questions,
deep
comments?
Magarasanam explanation ஐயா. வாழ்க வளமுடன்.
வாழ்க வளமுடன். எல்லாருடைய participants name.
Any questions from anyone?
வாழ்க வளமுடன்.
Yes, வாழ்க வளமுடன்.
It was a nice presentation, Rabi.
Mm.
And for once, I'm very happy that you come down to the physical level. So, but I would like to add one or two missing points in that.
Oh,
Is it okay?
yes, sure.
Okay.
That's the.
So, Makarasan, I know, as you have said, is a very, very, very beneficial asana. Definitely for the health of the spine and the whole health of the whole body. Makarasan is a very good asana. But Makarasana does not build muscle; it stretches the muscles. So now, to keep this thing health of the disc, you need to keep the intervertebral space. You should not narrow. You should see that it does not narrow, because only when it narrows, it pushes or it presses on the disc, and then the disc nucleus pulposus bulges out, causing a disc prolapse, and then pressing on the nerves, radiculitis, and referred pain, etc. So to maintain the health of the disc, two things are important. One is maintain the hydration of the disc. So that they have found lately that hydration of the disc, dehydration and dryness of the disc is the most important aspect for sciatica and so many other problems. Second thing is, to prevent the narrowing of the intervertebral space, you have to have the muscular strength, the sacrospinalis muscle that runs along both sides of the spine from the back of the head to the sacral bone. That muscle should be made very strong. So that is not possible by Makarasana. Makarasana stretches it, but then it does not add strength to the muscles. So you have to have the forward bending, backward bending, sideways bending, like Trikonasana, and then you have to have the rotation, like Kati Chakrasana, to keep that spine rotation. Of course, Makarasana helps in that rotation, but and you have to have weight training also on the isometric exercises. So that should take care of the back muscle strength. You never do any backward bending asana. In any work that we do daily, we bend forwards, sometimes sideways. And in Makarasana also, we bend side to side, we stretch, but we never bend backwards. So backward bending asanas are very, very important in managing the health of the spine and the intervertebral disc. So that is one thing I wanted to say. And then how this Makarasana benefits come about. So the mechanism, very important mechanism is by the manipulation of the fascia, and with the fascia and also the acupuncture meridians and acupuncture points which lie along the backside on the sympathetic chain, there, which are called the alarm points, acupuncture alarm points. So those points are manipulated very well by this Makarasana. So what is this fascia? Fascia is just the connective tissue, but it's the body's continuous network. So it serves as the physical and anatomical substrate in which the muscles are fixed. You can see the white lines when even in your slide, you could see. You see the red muscle, and then the white tissue in between. In some places that are thick and some places it's thin, but there is a fine connective tissue, the fascia, in between every muscle tissue and every muscle group. So, and then now the recent evidence is that most of this facial tissue contains the acupuncture meridians and points. About 80% of the acupuncture points are in locations along this intermuscular and intramuscular connective tissue planes. Now, there are some myofascial chains, they call it. That is, these facial chains are continuous webs of connective tissue and muscle that link your body from the head to toe. So they're popularly known as anatomy trains. If you Google anatomy trains, you will see them. So there is a superficial back line, there is a superficial front line, of course, a deep back line, deep front line, then lateral line, there is a spiral line. Makarasana affects the spiral line very well. And then there are some functional lines also. So these transmit the force, they let muscles work together. So when the fascia gets tightened because of a repetitive use of particular groups of muscles and some other muscles are not activated at all, like if you play tennis, you activate only the right side of the sacrospinalis, right hand and all that. If you play football, you activate only the calf muscles more and not the upper body. So like that, when there is a disparity between the action of the muscles constantly, there is different levels of tightness in these facial lines. And then this causes a ripple effect of tension and pain in a distant spot. So stretching this fascia along these lines helps to relax them, to increase flexibility, to relieve the tension and pain, and to increase the Shi circulation, that is the prana circulation, and blood supply also is increased to the muscles and organs so that they function very well. So this one has an effect on the meridian points also, acupuncture meridians and the acupoints also. And these acupuncture points are areas where there is an abundance of sensory nerve endings. So allowing it to trigger local nervous impulses and also immune system responses. So Makarasan helps in this area very well by stretching the fascia, by affecting the acupuncture meridians and acupuncture points. So that is one thing I want to add. Olga Valamadan.
Thanks for giving the acupuncture and pressure benefits, and the part played by the fascia is covered more in your specialty, and your contribution fills up, perfects the omitted subjects. And here, the relaxation is one thing which I didn't tell. I wanted to tell about relaxation. And in relaxation, we relax the muscle fibers, but not totally. And in certain types of practices of yogic way, what they do is they relax. Before they relax, they hyper contract, and suddenly they release the contractile force and achieve good relaxation. And by repeating this procedure, they achieve still more the complete relaxation. When the muscles are completely relaxed, when they are free from the uh, emotional as well as the higher neurological centers, the relaxation is complete and gives unimagined benefits. And Yogananda Paramahamsa mm, ex- gives importance to this point in his practices, and they are really very useful and helpful. Thank you.
Thank you.
வாழ்க வளமுடன் வாழ்க வளமுடன் ஐயா. It's nice presentation. Really gives us a deep knowledge about importance of Makarasana. I have few questions I noticed even today many are doing walking, but still people are facing back pains. Even I observed that on my exercise, but I felt like when I put my shoulders and I compress my spine, and if I do the slow walk, I feel that stress on my back. But when I raise my shoulder and raise my chest, and lift my muscles and walk, I don't feel it. So I just want to mention that, and is just want to confirm with the doctor that whether it is a right way to do it, or because that will benefit to the people. And also I have another I don't know, it's my thoughts, but it might be wrong, but I just want to clarify. Like whenever I think about spinal, it is connecting to all the organs, like thymus and uh, even digestive system, and everything is attached to the spine. And yeah, all the signals we're receiving from brain will be transformed through spine. So I was imagining like that, and even when I do uh, 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 nine center meditation, even when to think about the chakra, I'll mostly think about the organs and the exact location. So I just want to get your views on that one, Aiya.
Thanks for your points raised. And, what is your specialty? What are you doing?
I'm working in IT, Aiya.
IT.
Yeah.
And for IT man to talk about this finer aspects of it is really a good orientation, surprise orientation, which I have not seen in other ITs who are the bulk of the society. And
I'm
this
Vedatri student, Aiya.
very good, very good. And it requires more elaborate discussion to understand the points you raised that we will do sometime later.
Okay, yeah. Well,
Anyone else ask any questions, comments?
Tarun,
I have one more question, Aiya.
yes,
Stretching the spine and keep the back active. All I understand, yeah, but for the nutrition, to get those nutrition benefits, do we have to have any specific food, yeah?
food is
Yeah.
the just like the way you said, even in 9 center meditation, focusing in various points attends to various this thing, and all the points put together gives an overall coverage and this thing. Similarly, here the subject of nutrition for uh, I have come across a person who treats uh, diseases with food therapy alone, and his approach to the management of the problems is mainly based on the food, the prescription, and it is much complicated. I am not able to understand the restrictions he give and the recommendations he give for this thing. But his results surprise me to a great extent. For example, I have, I was, I happened to see a person with secondaries in the pleura producing hemorrhagic effusion. He was treated in Coimbatore with repeated blood transfusions to avoid the mediastinal effect on this thing. Effusion on one side with the shifting of the mediastinum and all. With the result, the doctor who this thing, he did pleural aspiration every time, and at one stage he was forced to re-infuse the removed blood for want of blood. So it was that much. And he was discharged from the hospital with expressed the inability of the attending doctor to manage the situation. He discharged the patient from the hospital, and I happened to meet that patient and sent him to the food therapist. And to my surprise, the intercostal drainage tube, it was removed, and the repeated transfusions were also avoided, and he was a taxi driver. And after a year interval or so, he wanted to drive the automobile again. To that extent, he was becoming all right. This by food therapy alone, and I feel that it is a very big specialty, and it requires a very deep understanding. Okay.
வாழ்க வளமுடன் ஐயா.
வாழ்க வளமுடன். With more understanding of the energies, the energy received from the universal magnetism, the space is converted into divine dust particles or the energy particles. And even after becoming the energy particles or divine dust particles, they retain their connection to the totality, absolute space. And this helps the meditator to instruct accordingly to get whatever new material synthesized in the body because of from the basic energy particles or paramanus, and the panchabhutas and the sabdatadus can be directed to replace the particular structure wanted by the patients. And this, I thought, will be possible by the auto suggestions and the handling of the energies, the subatomic particles. Okay.
வாழ்க வளமுடன் ஐயா.
வாழ்க வளமுடன். Santana Krishnan.
Thank you, doctor. I thought I will just tell one of the greatest benefits which my wife happened to enjoy by doing this Magarasana. She was suffering from the spinal sclerosis for a long time, and a lot of treatment from Ayurvedic and other places. She was given advice for spinal cord surgery, which she refused. And finally, I suggested about doing this Manavalakali and as well as Magarasanam. And she started doing, and things improved. And now for the last 10 years, she's totally cured and she is quite healthy. And now she's 72. By the blessings of our Maharishi, things are wonderful. And just last week, we went around the whole world, Australia, America, Japan, America, Norway, and then came back just last week. Everything went on very well. And thanks to our Maharishi and blessings. Thank you very much. Yeah, your explanation was wonderful. Then it was now, I could understand much more better the real the reasons for all these benefits in a more scientific way. Thank you. Thank you very much, Doctor. Thank you. I really appreciate it. வாழ்க வளமுடன்.
Aiya, I'm Leela
Yes.
Vinodan Aiya. I have a
Well,
constant pain in the right side neck. So constantly it is paining. That means the nerve passing through the vertebra, it's pressed in the vertebra. That nerve passes via the neck. It passes. I am doing a Magarasana for the past 10 years, 15 years regularly. But the neck pain is not, and the neck
well,
pain is recent only. For the past 5 years, it is there. But the Magarasana, I am continuing more than 5 years. So, any other exercise, especially for neck pain?
Leela Vinodan, the
Yes, sir.
neck pain. You see, our exercises are number of exercises are available for the neck movements, and
Okay.
in this long spell of 40 to 50 years of simplified physical exercises, the way how it relieves pain, why pain persisting is complicated. I would suggest that we both will meet and you will show me demonstrate the way you do the exercises, and
Okay.
we may be able to find out some reason. In many cases of this intractable pain where the results are not there, giving slight corrections help them a lot. So we will meet and discuss the
Okay.
corrections, whatever that is
Okay.
required. Okay.
Okay. Sure. Thank you, Aiya. Thank you. We'll meet it earlier.
Yes.
Thank you.
Right.
Thank you.
Tarunji, வாழ்க வளமுடன்.
வாழ்க வளமுடன். So I just wanted to, I mean, we are over time, but quick conclusion from my side. I'm one of those IT person that I talked about and a mathematician. So most of the technical terms went over my head. But one thing I realized from what Aiya said and Dr. Devi said is what I'm doing is in the right direction. So I have fortunately been blessed with good health so far. So it reinforces, though not understanding the technical term, but the way I'm doing it is very good way to do it. Definitely, I promised myself that I will start looking into the medical terms while I'm continuing my research work to understand how it's medically going to work. And this presentation is definitely going to help me out more on that direction. Thank you, Aiya. வாழ்க வளமுடன்.
Aiya, shall we conclude the session? ஐயா வாழ்க வளமுடன். Aiya, shall we conclude the session, Aiya?
Definitely. All are waiting for it.
Okay, Aiya. Let us conclude the session with our blessings. May the world be blessed with plenty of rain, the farmers work to produce an abundance of grain. Let practitioners of all prosper, flourish, and grow, and culture progress through the need to share and grow. Let the rulers be beyond feelings of anger or fear, illiteracy, poverty, and all evils made to disappear. Let the true lamp of knowledge burn steady and bright. Our sense of duty guide us along paths always right. உலகமெல்லாம் பருவமழை ஒத்தபடி பெய்யட்டும், உழவரெல்லாம் தானியத்தை ஓப்புடனே பெருக்கட்டும், பல தொழில்கள் புரிகின்ற பாட்டாளி உயரட்டும், பகுத்துணர்வில் தொகுத்துணர்வு பண்பாட்டை உயர்த்தட்டும், கலகங்கள் போட்டி பகை கடந்தாட்சி நடக்கட்டும், கல்லாமை கடன் வறுமை களங்கங்கள் மறையட்டும், நலவாழ்வை அளிக்கும் மெய் ஞான ஒளி வீசட்டும், நம் கடமை அறவாழ்வின் நாட்டத்தே சிறக்கட்டும், நம் கடமை அறவாழ்வின் நாட்டத்தே சிறக்கட்டும், நம் கடமை அறவாழ்வின் நாட்டத்தே சிறக்கட்டும். வாழ்க வையகம், வாழ்க வையகம், வாழ்க வளமுடன். தேங்க்யூ. வாழ்க வளமுடன்.
வாழ்க வளமுடன்.